Internal causes of disease. The internal causes of disease are known as the seven emotions. Grasp how big that is. The only internal cause has to do with our emotional state. Our emotions are of the utmost importance for our health. All of the emotions affect two organs. The liver. Remember we said how stress affects the liver? It's all emotional stress. It will affect the flow of the liver qi. And the second organ is the heart. That's because the heart houses the shen, or the consciousness. And so when the consciousness is affected by emotions, the heart is affected. Okay, so both those two organs. Then they will affect other organs as well, depending on the type of emotion. So what anger will do is it causes the qi to rise and affects the liver. This is why when somebody gets really angry, their face gets flushed, right? Their eyes get red. Okay, this affects the liver because the liver yang tends to rise. So when you get anger, it affects the liver, creates heat in the liver, and then that yang rises up to the head. This is unfortunately, a common cause of stroke. Someone who has they have too much heat in the liver, or yin deficiency with yang rising, because the yin isn't balancing the yang, and the yang rises up. When they have that going on, or they have too much anger, it'll send the yang up, and then it can cause a blocking in the brain, blocking of flow, and they can get a stroke.
So is liver deficiency the same like genetics as well? Like so people say have strokes in my family.
Yeah, so when you talk about genetics in Chinese medicine, the closest correlation is essence. And so someone will have a certain predominant deficiency within that essence that could lead more to a yin deficiency or a yang deficiency. And so that predisposition to stroke could be one of those things, but not necessarily. It's trying to put two things together that are separate topics from different models, but it's the closest that we can do at this point. Okay. Joy slows the qi and affects the heart. The way that I was taught this is because joy will cause an expansion, right? You feel expanded when you're joyful. And it expands the arteries. And so when the arteries are expanded, the blood slows down, and hence the qi slows down. Yeah, one more time. So when we're joyful, we have an expansion of our energy. We feel expanded. And so that opens the blood vessels. And then when it opens the blood vessels, the blood doesn't flow as fast because there's not as high a pressure pushing it. And so the qi slows down. Worry will knot the qi, which means it'll make the qi get stuck. Okay? When you're worried, it'll affect the pancreas and the lungs.
Is that the same as being stagnant, or is that different?
It is a stagnation. Yeah, it's a stagnation. Good. But they call it a knotting of the qi. Knots the qi. The interesting thing is when we worry and the qi gets stuck, it's not free to flourish and flow. And the answer to what we're worrying about is less likely to come. Shock will scatter the qi. When you get shocked, your qi will go and shoot out, scatter outwards. And the organs are the kidney and the heart. Heart because of the consciousness. The kidney, I would relate it to fear, which we'll talk about in a sec. Pensiveness also knots the qi. And that's overthinking things, which is very similar to worrying. You're overthinking things. And since pensiveness and intellect are related to the pancreas, that's the organ affected by it. Sadness and grief will deplete the qi and affect the lung. Or last week when we talked about the Charlie Brown example, When he's sad, he hunches over, right? His lungs aren't open, so he's not breathing as big. If you're not breathing as much air in, you're not getting any of the heavenly chi to come down. You're not breathing in and creating chi. And then fear will descend the chi. It'll make the chi go downwards. Okay? Which is why, similar to shock, like when you get shocked, you get scared and you get fearful. That's why I think it also affects the kidney for shock. But an example of fear descending the chi is when someone gets really scared and they urinate themselves. Right? That's the chi descending downwards. It's dumping down.
So is the idea that these are the only 7 emotions recognized in I mean, I don't see anything necessarily missing. I'm just curious. Is this sort of how Chinese culture in general, or just Chinese medicine orients the emotions?
So how Chinese medicine orients the emotions. If you have another emotion you want to talk about, it would probably fit in one way, shape, or form into these 7. Yeah, as like an extension or a nuance of these.
Can you talk about shock again real quick? I guess I'm just a little confused by scattering.
Yeah, so if you ever get, like, if you watch a scary movie and you get shocked by something, you're like, chi, you'll feel this like in your heart, the chi or the energy will like shoot outwards in all directions. That's the scattering of chi. So it doesn't stay like congeal or like contained. It doesn't stay contained while it shoots out, and then it takes time for it to come back to its normalcy.